Inside of your packet, you will find a round liner, a round shader, a magnum, a piece of pre-stenciled synthetic skin, and a shading study to refer to while you complete your assignment. The first needle configuration we will be using is a 9 round liner. We're going to use this for the initial line work. The first 2 digits denote the thickness of each individual needle. This is considered a 10 gauge needle, and it is thinner than a 12 gauge needle. 10 gauge needles are considered bug pin needles. The second set, this 09, denotes the number of needles in the configuration. And lastly, the RL denotes the configuration type. The RL stands for round liner. The second configuration we will be using is a 9 round shader, and we will use this for the secondary or thicker line work. This needle and tube combo is a 1209 RS. The first 2 digits denote the thickness of the needle. This is a 12 gauge needle, which is largely considered standard. The second set of numbers denotes the number of needles in this configuration. And lastly, the last 2 letters denote the type of configuration. RS stands for round shader. Round shaders are looser and often tacked back farther than the round liner configuration. The final needle configuration we will be using to complete this tattoo assignment is the 9 Magnum. This needle and tube combo is a 1209 M1. The first 2 digits denote the thickness of each individual needle. This is a 12 gauge needle and is considered standard for most lining, coloring, and shading. The second 2 numbers are the number of needles in the configuration. For this needle and tube combo, there are 9 needles. The last 2 letters and or numbers will denote the configuration itself. This configuration type is a Magnum or M1. The Magnum needle configuration, commonly referred to as a mag, may resemble a flat paintbrush. The Magnum consists of 2 rows of needles. The bottom row, for the 9 Magnum, consists of 5 needles, whereas the top row consists only of 4. Magnum needles will always come in odd number configurations. However, their stagger and spread may vary between manufacturers. We will be using our 9 mag to complete the shading of our ship. In order to use our needle and tube combo, we must first remove it from its plastic casing. If we flip it over on the paper side, you'll note this plastic tube was sterilized with EO gas. EO gas refers to ethyl oxide and is a type of chemical sterilant. Plastic tube and needle combo will remain sterile until the expiration date or unless the package is damaged. Before placing our needle and tube combo into the machine, we need to make a slight adjustment. In order to do so, we're going to remove the needle from the grip. Now, let's take a look at our needle. The needle has 2 components, the needle bar and the needle head. You will note that the needle head should always be on the bottom of the needle bar. A handy way to make sure that this is correct is to observe the back end of the needle bar where it appears in a question mark shape. Before we can place our needle back in our tube, we need to make a slight adjustment. We're going to bend the needle bar. To do this, we're going to place our thumb on the needle bar opposite where it connects to the needle head. We will then place 3 fingers in the center and a thumb from our other hand on the rear. Using your middle finger in the center, apply a small amount of pressure with your surrounding fingers supporting. Then we'll place pressure with our thumbs and create a slight bend. If the bend is too much, you can straighten using a slight amount of pressure between your thumb and forefinger, and then bend again. Careful not to repeat this step too many times as it may weaken the needle bar, but you do have some room for correction. This slight bend will allow the elastic tensioners to pull down on the needle bar and stabilize it without causing the needle head to come up off of the tip of the tube. Before we can place the needle and tube combo into the machine, we must first bag our machine. Bagging our machine protects ourselves and our clients from cross-contamination. Make sure that your tube vise is loose enough to allow the tube to pass easily. Let's place our needle bar into our tube. Make sure that the head of the needle is on the bottom of the bar, as we can see here, and the rear should create a question mark-like shape. Let's set that off to the side for now. To place our machine in the machine bag, we're simply going to insert the tube vise into the upper left corner. This will allow access to our clip cord, as well as room for the moving components of the machine. We're going to pinch using our thumb and index finger to apply pressure against the plastic along the tube vise. Now, let's secure our needle and tube combo by placing our thumb against the needle bar. Now we're going to push our needle bar against the plastic to pierce. Once the needle bar has penetrated the plastic and the tube has been inserted, we're going to tighten the tube vise. Once the tube vise has been tightened, we can peel the plastic back and adjust the tube. Once the needle and tube combo have been inserted through the tube vise, tighten the tube vise slightly. Then we need to insert our half grommet or nipple into the needle bar. Observe that the needle bar is on top of the needle head. Let's pull that back, up and over the armature here. Then we adjust our tube. We want to make sure that the needles are not sticking out past the plastic when they're in a resting position. So the tip of the tube here. Tighten the tube vise. And now, let's put our elastics around the machine. We will then recover the machine. And now we're ready to tattoo.